Welcome to Kenton's videos. Enjoy the video.
You begin by forcing calm. Lie down, lower activity, and aim for extra sleep because your immune system heals faster when rested. Once settled, sip warm fluids and clear liquids. They thin mucus and keep you hydrated. Then, take appropriate OTC pain relievers for fever or body aches. Follow dosing instructions. Make sure to use saline nasal spray or steam for immediate nasal relief, and monitor symptoms so you can adjust care if fever or breathing issues appear. Once initial measures are working, focus on targeted symptom control to speed recovery. You should rinse or spray your nose with saline to flush irritants and reduce inflammation. This helps drainage and eases breathing. Make sure to humidify the air to loosen mucus and use honey for cough suppression if appropriate. It soothes the throat. Also prioritize easier-to-digest proteins and vitamin C-rich fruits to support immune cells, and avoid smoking or alcohol because they delay healing and worsen inflammation. To finish strong, slowly reintroduce light activity as you feel better instead of jumping back to full routines. This prevents relapses. If symptoms worsen, high fever, difficulty breathing, chest pain, or persistence beyond about 10 days, seek medical evaluation because complications need treatment. If congestion lingers, consider a short course of nasal steroid spray to reduce inflammation. Start it once acute infection is controlled and follow instructions. Troubleshoot by tracking symptoms daily.
Thanks for watching. Consider subscribing if we helped you.